Colorectal cancer making headlines in 2026 after taking the life of actor James Van Der Beek at the age of just 48. It's the second leading cause of cancer deaths in the U.S., with around 55,000 people who die from it each year.
And the rates and the cases in younger people are on the rise. March is Colorectal Cancer Awareness Month, and joining us around the table to talk a little bit more about this is Dr. Arthur Yan, a gastroenterologist from Scripps Memorial Hospital. Thank you from Sharp. Thank you so much for being with us this afternoon. This is such a mystery for so many people that are on the outside. We all have to get our screenings, that sort of thing. But what's happening with these, with the rise of colorectal cancer right now?
Yeah, first of all, thank you very much for having me. So yeah, colon cancer has been on the rise over the last 20, 30 years. So there's been about incidence of 2% increase annually since the 1990s. So colon cancer now is the second leading cause of death in the United States. For patients below the age of 50, actually, it's the #1 cause of colon cancer, #1 cause of death from cancers in general. About 3/4 of patients who actually get colon cancer when they're diagnosed before the age of 50, it tends to be in the more advanced stages. So it is on the rise, and we're seeing more severe stages in younger people.
And one thing I think a lot of people have a misconception about is, oh, this only impacts men, or it impacts men more often. Maybe women don't have to be so concerned about it, but we actually just saw with actress Catherine O'Hara dying from complications of it recently. What's your message to people to know that it just doesn't just impact men?
Yeah, colon cancer occurs men and women. Yes, it does predominantly occur in men, but both men and women both are at risk for that disease. We tend to think about prostate cancer in men, breast cancer in women. Lung cancer remains the #1 cause of cancers, but colon cancer is #2, and it's not the typical thing we like to talk about at the dinner table and with friends and family, but it's quite high up there and something that everybody should be aware of.
Are there risk factors? Are there things that we're doing in our daily life that expose us to a greater chance of contracting colorectal cancer?
Absolutely, yeah. So we know obesity, a sedentary lifestyle are one of the two more common causes of colon cancer, especially in the younger adult population. We know alcohol, smoking. There's probably been less smoking and alcohol in the general population, but certainly these are two risk factors for colon cancer. Diet high in red meat, low in fiber. We think processed foods and even ultra-processed food may play a role, especially in colon cancer in younger adults, although that current research is still pending, with all of that. And it's also other risk factors, family history of colon cancer, people with a history of Crohn's disease, ulcerative colitis, and also patients who've had colon cancer, even precancerous polyps found on prior screening.
What are the symptoms of this?
Yeah, so for colon cancer, typical symptoms is weakness, fatigue, which could reflect iron deficiency anemia, certainly rectal bleeding. If you notice black, tarry stools, bright red blood, these are signs to talk to your doctor about. Unintentional weight loss. A lot of people like to lose weight. Some people lose weight and they don't know why they're losing weight. That's also kind of a red flag we think about. And also when you see your doctor getting routine blood tests, sometimes you can pick up anemia and other abnormalities that would warrant further workup.
So if you were going to give someone just the rundown, do this, you'll have a better chance. Don't do this, you'll have a better chance. What would that be, Doc, for all those folks that are watching?
Yeah, first thing is see your doctor. Get a primary care doctor, see your doctor regularly. There's a lot of screening for blood pressure, cholesterol, prostate cancer, breast cancer, in addition to colon cancer. That's #1. And when it comes to colon cancer screening, when your doctor says, hey, it's time to get the stool test or see a gastroenterologist for your colonoscopy, certainly schedule that. Don't put that test away and put it in the drawers and think about that later. It's important to do that, especially with the new guidelines. Well, I'll say new, it's been about 5 years now that we start screening at age 45, not at age 50. A lot of my patients still think, I thought it's supposed to be 50 years old. Why am I being referred to see you? New guidelines is 45.
And if you do these screenings, you're going to be doing far better, because catch something early and you can actually handle it, catch it late, and there's some serious problems.
Absolutely, and there's different types of screening too. There's the stool test, it's an immunochemical test where we look for blood, and if there's blood in your stool, then you're referred for a colonoscopy. There's also multi-target DNA that's done in addition to the FIT test, the immunochemical test, looking for blood and looking for DNA. The gold standard is the colonoscopy, where you actually come in and get a procedure. We always talk about the dreaded bowel prep that happens beforehand, but the procedure is really simple. Patients are sedated for the procedure. It takes about 20-25 minutes. We look for polyps. We can remove the polyps. So it's really the only screening test that you can detect and prevent at the same time.
I know you said you only recommend it typically for people over the age of 45. Now, is there any reason you would recommend it for anyone younger?
Yeah, that's a really good question. So patients who have a family history of colon cancer, especially a first-degree family member who was diagnosed with colon cancer before the age of 60, 2 second-degree family members diagnosed before the age of 60, patients who've had a history of polyps, Crohn's disease, ulcerative colitis, or even genetic conditions, familial adenomatous polyposis syndrome, Lynn syndrome. These are all conditions that would warrant earlier screening.
Dr. Yan, thank you so much. From Sharp, if you need anything, I'm sure you're the guy to go to.
Thank you very much.
Thanks
Really
so much for
appreciate it.
coming in. We appreciate your expertise today.
Thank you.